Alright, so this is my Paramedic primary healthcare epistaxis osce. I've been called to Bethany here, a 23-year-old female whose chief complaint is a bleeding nose, also known as an epistaxis. So Bethany, the bleeding has been consistent for 25 minutes or so now.
Or about, yeah.
Yeah, and you've been applying direct pressure for roughly the same time.
Yeah, yeah.
Alright, so walking in, I want to gather a history. I want to see what I want to take, I want to observe what's going on, see if there's any signs of hypovolemic shock, I want to look for how much blood she's potentially lost. We may have to act quickly. I want to know if Bethany's on any anticoagulants. I want to get my osce to take some vitals to see if she's hypertensive or not, see if she does live with hypertension. Bethany, have you recently had any trauma to your face? No trauma to your face.
Oh, well, it's embarrassing to say, but I was picking my nose.
Okay,
That's
so
when
that
it
could
started.
be considered as digital trauma. Have you had any recent surgery?
No.
No, so that's something also to consider. Humidity in the room, is it warm? If it is, we want to preferably remove Bethany from the warm room to promote vasoconstriction. So what I want to do is I want to know if the bleeding is still going or not. To do that, I can simply just have a look. If you could just release it for a minute, Bethany. So the bleeding will continue. So if it had stopped after the 15 to 25 minutes of compression, unless she's on anticoagulants, what we can do is there's no further checkups required. But I would advise Bethany to see a GP within the next 24 hours if she were on anticoagulants. With mild epistaxis, I also want to make sure there's no kind of airway compromise, so I want Bethany to spit out while leaning forward. Any kind of blood she has in the back of her throat, because if she does swallow that, it can make her vomit and make the bleeding worse. I could also consider things like an ice pack at the back of their neck, at the back of Bethany's neck to see if that works. If it doesn't work, compression's not working, what I want to do is, it's severe, I want to think about adrenaline administration, possibly backup as well, if I'm an EMT. So Bethany, that's my plan. It's still bleeding.
Yeah.
You're losing quite a lot of blood. I want to draw up 1 in 10,000 adrenaline, administer that intranasally. Is that okay with you? Alright, so what I'm going to do is take my 10 ml syringe, drawing up the saline first. I'm going to drug check with my oscillator the saline. First, Nikita, if you could do that for me.
Saline 10 mils, expiring 2020.
Thank you very much. Saline 10 mils. It is in date. Do you have any allergies, Bethany?
No, not that I know.
So I'll draw up 9 mils of the saline. Draw up that first so I don't have to expel any of the drug that I'm going to put in. So I'm just going to attach a drawing up needle now. Right. Got wet gloves at the moment. I'm just going to pop that down. Oh, okay. I'm going to drug check my adrenaline. Nikita?
Adrenaline 1 milligrams, expiring 2020.
Thank you very much. Adrenaline, 1 mil. It is in date. Okay. How you going, Bethany?
Not too bad.
Not too bad.
Yeah.
So what I'll do is I'll draw all of that up. Putting that straight into there. Okay, so now I've got the dose I want, and popping that back on there. So what I want to do is just attach my MAD, my mucosal atomizing device. Oh, add my, make sure it's adrenaline here. And I want to administer 2 mils into each bleeding nostril. So to make life a little bit easier, administer that 2 mils and put this in a 3 mil syringe. All right.
Mhm.
Okay. Place that down, try to keep it as clean as possible. Okay. Before I do this, I do want to prime my MAD. What I'll do is, because I've got some of the spare. All right. So now that that's primed, so what I'll get Bethany to do before I administer the 2 mils into the bleeding nostril is blow her nose as hard as she can to get any clots out, so we can administer the drug to the site of the bleeding to get that vasoconstriction and the and then I'll reassess. Okay, so I want to get I won't put it to your nose, definitely, but I'll get her to lean back a little bit. I'll insert it into the bleeding nostril, get a bit of an angle on it, so I want to hit the site of the bleeding, and I want to put quite a bit of pressure to atomize the drug. So I'll just do that here. So you've blown your nose,
Yep.
get rid of all the clots.
Mhm.
Okay, so I'll do that in both bleeding nostrils. Get you to compress that again for another 15 to 20 minutes. Pop that straight in there. So after the 15-20 minutes, we'll reassess. If it has stopped, depending on how much blood she's lost, if she's on anticoagulants, I want to transport, if that's okay with you. If it has not stopped, definitely getting back up on the way, we can consider an ETT tube or nasal packing. And if I see signs of shock, I want to consider also administering some fluid. Okay?
Yep. Sounds good.
Cool.
Cool. So Maggie's called us today. She's been out at the gym this morning doing some deadlifts, things like that. She's gotten home and about a couple hours later her back's gotten a bit sore. So I've already done a full set of vitals, checked all of that. My offside is just cleaning that up now. Everything is fine, so we're just going to do a bit more of a thorough back examination to make sure it's nothing too sinister going on. And so I've gotten a bit of story already with what Maggie's told me. So first I just want to, if it's all right with you, Maggie, if I just have a look at your back, if that's okay?
Yeah, that's fine.
Cool. So first I'm just going to expose it, so I'll just lift up your shirt if that's alright.
Yeah, that's
Cool.
fine.
So I'm just looking for any major deformities, any bruising or swelling or obvious lumps or hard masses or things like that. And just visually it looks okay, there's nothing too sinister poking out at me. Is it alright if I just have a feel of it, Maggie?
That's
Just
alright.
push around? Okay. So I'm just going to start at the top a bit higher. So I'm feeling for any hard masses or lumps or any tenderness or any guarding or rigidity or anything like that. So there's nothing that I can feel. It feels all okay up there. It's a little bit tight through here in the muscles, but otherwise it looks okay. Sorry, excuse me. Cool. If I get you to, if you're right, me, if you just have a quick little walk for me just across the room and back again. Cool. So it's just in that sort of lower region across there.
Yeah, just down there.
Yeah, okay. You just want to grab a seat up on the table and shuffle your bum all the way back for me. Cool. So what I'll get you to do, can you wiggle your toes for me? Cool, nice. And can you point your toes as far forward? Bring your toes all the way back. Cool. Now can you push against my hands? Yeah. And pull. Cool. And go outwards. Okay. Sweet. So there's nice equal strength there. They're both feet are nice and warm. The limb baselines are both strong and regular. No difference between those. There's no, with the legs as well, there's no obvious deformities, no shortening or anything like that. Today, Maggie, have you had any been unwell recently at all? Any coughs, colds, or flus?
No, not really.
No. And you haven't had loose bowel motions since this pain or anything? You've got no funny sensation up in between your legs anywhere?
No, it's just sore.
Yeah, it's just your back across there. Okay. Sorry. Is your abdominal sore at all in your tummy?
No.
No? Okay, do you mind if we just have a little look at that? So if I get you to lie down on that pillow that I've already prearranged, that'd be great. So again, do you mind if I just lift up your shirt a little bit?
Right.
So I've just got just above your belly button. So again, I'm just having another look, see if there's anything obvious that's sticking out with me. And then if it's alright for you, maybe I'll have a little feel. So I'm sort of rolling my hand across, feeling for any masses or lumps. Anything that shouldn't be there. There's no rigidity or guarding or anything like that. And it all looks okay. That didn't hurt, did it? Just a bit like I'm poking on your stomach. So you've had no change. You can sit up if you'd like. So you've had no changes in your bowel motions or anything like that?
No.
No pain when you go into the bathroom, it doesn't sting or anything?
No.
Can you bring your leg, just do one leg at a time. Bring your knee up to your chest, so hug your leg, yep. And then it doesn't hurt it.
No.
You want to try it with the other one again? No? Cool. And then if you lift your leg straight up, is that okay? Yep. Beautiful. Cool, that all looks really good. So at the moment what I'm sort of thinking is it's just a bit of a muscle cramp from working out today already. There's nothing that's screaming out that's anything wrong with me. She's already had some of her own pain relief a couple of hours ago, so I won't be giving her any more because it's within the 4-hour limit, but I will write you a little piece of paper, maybe it sort of says, I've got one already prepared. So it's just got a little bit of advice on it. If you want to hang on to that, just keep taking your ibuprofen and your paracetamol. Do that every 4 hours. So you've had it 2 hours, go so in another 2 hours, take another dose of that. So 2 little pills each, 400 milligrams of ibuprofen, 1 gram of paracetamol.
Cool.
Cool. So you've got plenty of that at home. Keep taking those and keep moving around. We want to make sure you're moving around so your muscles don't seize up again and spasm. But just before we do, I'm just going to go through the red flags and quickly check those. Do you have any questions at the moment?
So you want me to walk around?
Yeah, so keeping active, keeping moving, that's the best thing. If you're just lying down, then the muscles are just going to cramp up, especially after being at the gym.
Yeah.
So going through the red flags, you've got no loss of bladder or bowels. You don't have the temperature. We've already done a full set of obs. You've got no rigor. You haven't been shaking it or anything like that. No rigors. The vital signs are all within normal limits. No pain in the thoracic spine or up in the chest, so no upper pain here. I've already gone through that in the primary survey. Abdo pain, nothing of that. There's no altered sensation in the saddle area. We will, however, check the sensation in your legs. We'll do that. We've seen her walk. She's able to mobilise well. And there's no signs of symptoms of general illness. There's no pain radiating down your legs, is there? It's just in that little
It's
band.
just
Yeah, okay. So what I'll do is just get a little pen or something to write on. All good? Okay. So if you just want to close your eyes. Feel me scrape. Feel that?
yeah.
Down there. Feels the same. Yep. On the top. Feels the same. Yep. It all feels normal, like it should. No difference in either leg.
My legs feel the same as.
Cool. All right. So there's no red flags met there. The orange flags. You don't have a history of cancer, do you? No. You're not on any immunosuppressants or steroids or anything like that. No. Pain hasn't been getting worse overnight, or it's not night time. Yeah. Cool. No recent unplanned weight loss. No. Cool. No. Pain isn't really going again. You don't have osteoporosis, do you? No. Haven't been taking any drugs. Awesome. Cool. So we'll leave you with that information sheet. If anything does change, you can always call us back, but otherwise just keep mobile, keep taking your pills.
Well, thank you very much.
That's okay.
Cool. So we've been called to Nikita here, and I'll be doing the migraine section of the osce. We've been called to Nikita, done our primary survey, ABCs clear. We've got our history, and we're just going to investigate a bit. So you've got a migraine, Nikita? And how long have you had that for?
A few days.
Few days.
Yeah.
We've established that she does not see an aura, so it's migraine with no aura.
Yeah.
So we've got our history. We've done that. We just had a full set of vitals. My offside are over there. And then they came back all normal, and then we're just going to test the nerves in your face and everything just to make sure everything's okay. You alright with that?
Yeah.
Cool. So I'm just going to start off with the olfactory nerve, which is just your sense of smell. So if you just cover one nostril, and I'll just get you to sniff this, and then the other nostril, and they both smell the same.
Yeah, they do.
You could smell what this is. Cool, that's marvelous. And we're going to go to the oculomotor, trochlear, and alveolar nerve. So I'm just going to feel across your eyebrows and under your cheeks and everything. That's right. Normal sensation. Nothing felt a bit odd there. You felt it on both sides of your face. Cool, that's good. Your facial nerve. I'll just get you a good scrunch of your face for me. Good. And so I'm just going to test your sense of sound. So if you close your eyes for me, and I'm going to click on either side, and if you could let me know which side it is.
Oh, left.
Your left side? Yeah.
Left side. Right side. Right side. Left side.
Yeah, very, very good. Very well done. Your vagal nerve. I'll just get you to give me a good Oh, very well. Do you sing?
Not really.
Not really. Oh, you should. And just a bit of a Good. No problems there. And your accessory nerves and muscles. I'll just get to shrug your shoulders for me. And I'll just, against my hands, shrug your shoulders. Ooh. Very good. No issues there. Strong. Same strength behind everything. And we just got one more nerve. I'll just get you to stick your tongue out. And touch either side of your mouth with your tongue. That's well done. Nothing feels odd there.
No.
Right, so I'm just gonna. I have a list here,
Yeah.
which is it's just a bunch of red flags. Make sure there's nothing too serious. So we'll just go through that.
Yeah.
If I get you to move your head and neck, so look side to side and up and down. Does anything feel abnormal there?
No.
No pain? No pain?
No.
No, it doesn't change the pain in your head at all?
No.
So tell me about the onset of this headache. So you said it's been going on for 4 days.
Yeah.
What were you doing when it came on?
Well, it's been stressful, and I found out that my husband is a sugar daddy, and he's been seeing all these ladies. And then I got overwhelmed because more guys were coming to me as well, and it's just like a lot of men and overwhelming. You know,
Right.
like everyone wants me.
I see. So did that cause the headaches to come on sharply, or over time it progressed into...
Over time, because like one every day, and then two, and then like it's stressful. I can't handle it.
It's okay. Well, I'm here to help now. We in our vitals she had a temperature of 36.9, which is less than the temperature that is a red flag, and you've had no signs of being sick, cough, cold.
No, healthy.
Healthy, good on you.
I've always been healthy and don't take any medication.
Oh, okay.
Just that, like, I have like usual migraines, but
So
the
you,
doctor knows about it.
Oh, okay.
It's like, it's not like always, like, you know?
yeah, I understand. Have you had any nausea or vomiting?
No,
Not at all.
no,
Have you had any altered level of consciousness,
No.
about dizzy or woozy? You've been
no, yeah.
okay. That's good. Have you had any trauma to your
No.
head? No falls?
No.
You ever knocked it on anything?
No,
No. Do you have any known bleeding disorder?
no,
You don't take
No.
any anticoagulants? No. So where was that pain again?
like here.
Alright, so no signs of temporal arthritis?
No.
No. And you're not pregnant?
No,
No.
fortunately.
And do you have any history of intracranial bleeds?
No, I don't
So
think
like like brain bleed, stroke or anything?
No,
No.
I don't have it. My family doesn't even have it.
So you don't, your family doesn't have a history
No.
of cerebral vascular
No,
abnormalities?
no,
And this is I know this is a bit of an odd question, but you weren't having sex when this headache came about?
no.
No. Okay. That's good. So
I
you don't
have been.
well, you don't have any of the red flags here. You don't have any pain in your nose, eyes, like, in your sinus?
No, just my heart.
Yeah. And this, you said you had migraines in the past. This migraine is not any
No.
different to the past.
Just a little bit stronger.
The pain is a little bit stronger.
Mm.
Alright. So, you've said this pain is at risk. Did you want some pain relief?
Yes.
Yes, you haven't had anything today?
No.
Alright, so what I can give you is some paracetamol and ibuprofen.
Yeah.
You might know it as like Panadol and Nurofen if you
Mhm.
decide to go to the supermarket. You weigh less than 80 kilograms. I just get this drug checked.
So it's Panadol 500 mg expires 2020, ibuprofen 200 mg expires 2020. It's all good.
Marvelous. So these are, you're right with swallowing pills?
Yeah.
Okay, so I'll just give you 2 of each. So that's 1,000 milligrams of paracetamol and 400 milligrams of
Yeah.
this one. You don't have any problems with your liver?
No, I'm healthy. No allergies.
No
nothing.
allergies?
Yeah.
Cool. Just if you hold out your hand for me. Cool. You drinking enough water? Yeah. Cool. So we'll suggest that you go talk to your doctor. Just sort out a better management plan if you find that you're not really coping too well with these migraines. What I have for you here is a pamphlet. It's got just some things that you should look out for.
Yeah.
If you get any of these signs, maybe consider calling us back. Just some pain, what would be advised for pain relief, and sort of what a migraine looks like and what something.
Oh,
that
sweet.
can
Thank
cause it.
you. Thank you.
Yeah, no worries.
I'll make sure that I'll see my doctor today as well. So.
Yeah, all the best with that.
Thank you.
Go see them. You don't need to. I don't think we need to take you anywhere.
Okay. That's fine. That's fine with me.
Yeah, and then of course we'd go over a non-transport checklist. But just do that and.
Yeah. Thank you.
Yeah, no worries. All the best.
Thank you. Thank you.